239. From our recent discussion with you, we told you that more males were involved than females. Reported 206 cases. As at April 19th, there were only 9 cases in Obuasi. But between 21st to 27th, the cases went up to about 300 cases. That was less than 6 days. The index case that actually caused this situation was a case that died. He has been in the community close to 2 weeks and has been sick. Fortunately, he operates around the market area of the family. So after the case was confirmed, we had so many contacts from the market area and then other areas in Obuasi. So all their samples were taken. However, because of the challenges we were having with the lab, with the backlog, the cases that were taken from 19th to 27th, we had the results on the 8th to 13th. And that was the reason why all these cases were identified during that period, May. However, all of them were cases that we diagnosed in April. And we started with intensive enhanced surveillance, contact tracing, and then tried to emphasize the importance of working closely with the municipal assemblies and then the district assemblies to get the people to abide by the rules and regulations as far as safety protocols are concerned. So I must congratulate all of you, including the regional minister, the municipal, and then the district chief executive. They work so well. And as at now, the good news is that the new cases of infection in Obuasi has reduced. We will project it for you to see that it was only during the period of 19th April to 27th April that we had the upsurge of the cases. And since then, the number of cases have reduced in Obuasi. So all the interventions that needed to be done is to reinforce what we are already doing. Adhering to the protocols and guidelines as far as personal hygiene is concerned, the use of sanitizers, and more importantly, wearing of the face mask and the social distancing. That is the key. And once the people of Obuasi and then other areas adhere to the protocols very well, I don't think we'll have a lot of cases anymore. All those who were confirmed positive, those who were sick or have mild infections, were admitted to our our treatment center. And then those with no symptoms at all are being isolated in 4 of our isolation centers. The 2 of the isolation centers are in Obuasi, and we have 2 here in Kumasi. And all of them are doing very well. One major challenge that we have right now, and that we want all of you to help to address, is that of fear, stigma, and discrimination as far as people of Obuasi is concerned. As I keep on saying, if that's the way we will drive the agenda of COVID-19, with stigma, fear, and discrimination, we will not achieve any results. We had opportunity to talk to some members of the community, and even those who are operating in other towns, that anytime they go around and they say they are from Obuasi, then it becomes another issue. People don't want to sell to them and other things. So all of us should understand that we are fighting COVID-19. We are not fighting people. We are not fighting Ghanaians. It's through no fault of theirs that they have the infection. So as much as possible, in our communication, let us make sure that we don't create any situation that will breach confidentiality and also cause fear, panic, and stigmatization as far as our fight with COVID-19 is concerned. We want especially the media to be very circumspect in some of the issues so that they will know the questions to ask and questions not to ask. And I must take the opportunity to thank all of you who has meaningfully contributed to this situation. I must say that the situation in Kumasi is perhaps one of the good examples that we can have. Despite the fact that Kumasi and Accra started on the same level, as at now, when you look at Kumasi and what has happened, I must say that Kumasi Metro and then Greater Kumasi, they've done so well. In fact, if you look at the data, you realize that the infection rate in the Greater Kumasi is so low. That means that we need to congratulate them, because that means they are adhering to the protocols and guidelines and they are doing right thing. Whatsoever they are doing, what we will urge them to do is to try and then do it more and even intensify it, because the fight is not yet over. In our recent discussion with you, we told you that more males were involved than females. But the situation in Ashanti region is not same today, because now its male is 49% and female is 51%. And as I keep on saying, it depends on your exposure. But the reason is that most probably most of the cases that were coming from Obuasi were from the market area. And for that reason, we know that most women are in the markets. Maybe that's the reason why we are having these differences. As at now, 139 confirmed cases tested negative after initial repeat test. That is the recovery. If we say recovery, we have a protocol and guidelines also guiding what we call recovery. In Ghana, under our protocols, when we say you've recovered, that means that after 14 days of infection, we subject you to 2 tests within 24 hours, and all the 2 tests should prove negative. So that is the way we do the recovery. And because this is a very high standard, that's the reason why sometimes it gives the impression that the number of recoveries are low, because it's basically based on the efficiency of the laboratories. So if the laboratories are not giving us real-time data, then it gives that impression. However, in all, every epidemiologist will tell you that once you know the incubation period of the disease, so for instance, here the incubation period is 14 days. All that you need to do is to multiply 14 by 2, and you get 28. So if you get the infection after 28 days, it's expected that you will recover. However, we only need the lab to confirm this. But as far as epidemiology is concerned, in the way we do, as far as the viral conditions are concerned, you are recovered when you multiply your incubation period, that's 14 days by 2. So after 1 month of infection, it's expected that if you don't die, you will recover. Why do you have to recover even without treatment? The reason is also very simple. You are recovered because the immune system in you is fighting the infection. And once we have your immunity strong, definitely the infection will subside if you don't succumb to it. So that's one issue that we have to understand as far as the recoveries are concerned. Currently, we have 15 people on admission and 75 are in isolation. We have a cumulative contact list of 1,283. And as at now, we have 54 active contacts being followed up. We've taken a total of 49,988 samples in Ashanti region. close to 50,000 samples. The routine sample is 1,335. The community screening, that is the enhanced surveillance, yielded 42,586. Then the travelers that we screened were 1,387. And then contacts of confirmed cases, 4,352. So far, that is the situation in Ashanti region. The good thing is that the rate of infection is going down. The number of new cases that we are having are not as many as that we recorded in April, comparing that of May. So that means that whatsoever we are doing it right. And that we should continue to do it and then adhere to the protocols and then the guidelines. And I believe that God willing, we will overcome. So thank you for coming, and God bless you. The greater capacity is so low. It's perhaps one of the in some of the issues, so that they will know the questions to ask.
Support municipal massive 20 cases, not for the districts and municipalities which have not recorded any case at all. Currently, 25 level, we are having more females having condition. The first time that the Ashanti region is recording this, with more females having worse peak, but certainly, whereas at a certain point in time, we had first case in the Wasi, the cases kept on increasing by day. And then over a certain time, and the red represents the confirmed cases out of these total number of samples, the native number of cases. And I think it's important to indicate here that these individuals on admission at the two of our treatment centers